Hi everyone, good evening and welcome to another episode of ParentTown TV. Today we have Dr. Tiffany Tan with us, who is a dentist at the Dental Designs Clinic out along Telok Ayer Street in Singapore. And we're going to be talking to you about oral hygiene as well as how you can care for your child's teeth. Dr. Tan, thank you for joining us today.
Thank you for inviting me.
So, oral hygiene, that's a big topic for a lot of people, At what age should kids actually start seeing a dentist?
Well, the American and Australian guidelines, they actually recommend to start at 1. But in Singapore, most people start bringing their kids at 2 or 3 years old. The reason for that is because it's easier for the parents to control their kids when it's about 2 years old. That's when they start understanding how to understand instructions from the dentist, instructions from the parents, and to cooperate in the chair. But age 1 is actually good.
So have you personally seen a lot of patients age 1 come on by the dentist?
Yes, and I think the important thing is to understand that at age 1, it's not so much of a dental checkup as it is a wellness check for the patient. So the dentist will probably ask you questions like, how's the diet of the kid? How are they brushing? Have they started brushing? Are you cleaning for them well? Those sort of things. Because once decay starts, and it can start anytime once the first tooth comes out, which is at about 6 months. So once decay starts, it's often too late to prevent that. So we want to prevent decay by starting early, which is at about 1 year old.
Okay. What about yourself? Do you happen to have any cavities or any dirty little secrets we should know about?
Well, fortunately, I've been very lucky. I've had quite good teeth. My parents were very strict when I was growing up. So they did everything, they brushed my teeth, they made sure I sat down and brushed with them. But I think one thing that they didn't do so well was diet. So I had cavities in my teeth, in my baby teeth when I was younger. So luckily they were in my baby teeth, and that scared me so much. I started to be very careful.
So if you have cavities in your baby teeth, it doesn't mean you're going to have cavities in your adult teeth?
There is a correlation actually. There have been studies to show that if kids have cavities in their baby teeth, they tend to have cavities in their adult teeth as well. So that's why it's important. It's mainly because of the habits as well, because they don't have the good oral hygiene habits from young. So that's why in adulthood they don't have the same habits. They don't brush their teeth, and that leads to the dental decay.
Okay. And so what is considered good oral hygiene? Must I floss my teeth every day? Do I need to brush 2 times a day, 3 times a day? What's the protocol?
Well, ideally it's brushing at least twice a day for 2 minutes every time. Try to brush after food, so after breakfast, after dinner, and don't eat anything after brushing.
So when you say after breakfast, so you have your breakfast, you drink your juice, and then you brush your teeth?
That's right. I know it's very difficult for many people because, especially for kids, because they're rushing to school, parents are rushing to work. It's chaos in the morning. So if you can't brush after breakfast, at least try to brush before. Brushing is better than not brushing.
So you should eat breakfast fast and then brush your teeth.
Ideally.
Which is not the usual practice in most households, right?
That's right, yes. Because as I said, it's difficult to manage. We have to be practical as well. Ideally, you brush after breakfast, you keep your teeth clean the whole day, and after eating, you brush your teeth again, you keep your teeth clean when you're sleeping. That's the ideal. But we've got to be practical. You've got time to manage, you've got the kids to manage. So at least maybe brush after they wake up, at least brush twice a day. I think that's good.
And must you really floss? Is there any way out of that one?
Well, brushing, actually, it only removes the bacteria from the front and the back of the teeth. It doesn't remove from in between the teeth. So flossing is what removes the bacteria from in between the teeth. So that's you must floss.
And so at what age should children start learning how to floss?
I think once they can start tying their shoelaces, that's a good age kind of guide, because that's when they can start using their fingers properly. Before that age, they can't really manipulate the toothbrush, let alone flossing. So the earlier the better. Maybe about 3 years old, 4 years old, if they can, start trying with they've got the floss on the picks. So they've got a handle, they can use that. It's a bit easier.
Okay, that's a great tip. What about brushing their own teeth? When should kids start brushing their own teeth?
They should start as early as you can to build in the habit, but they probably can't brush very well. And kids, they lose interest very quickly. So if the parents should always let the kid brush first, and then you brush for them after to make sure it's clean. So at about age 1.5, 2 years old, they can start doing it with the brush by themselves, and then the parents jump in after to make sure it's clean.
So we see all of these different types of toothpastes available. Some of them have flavor, some of them are salted. God knows why anyone would use a salted toothpaste, but I've experienced it. It wasn't one of my most pleasant memories. So you use menthol. So what's the recommended type of flavor of toothpaste for kids to use?
Well, I think kids, the flavor doesn't matter. It's more of the fluoride content they have. But the flavor, kids generally don't like mint. So if you're trying a toothpaste, maybe try something other than mint.
Okay.
Yeah. And the fluoride for kids younger than 6 years old, try to stick to maybe 500 ppm. They write that on the toothpaste. Over 6 years old, you can start with 1000 ppm, which is the same as the adult one. But make sure they always spit, that they don't swallow the toothpaste, because it can lead to some bad effects on the teeth.
So must I buy a toothpaste from the dentist, or can I buy one of the over-the-counter Colgate, Oral-B?
Yeah, you can get toothpaste from anywhere. You can get it from Colgate, Oral-B, Sensodyne, everything. It's just the ppm that's of the fluoride that is important.
So for kids under the age of 6, you were saying 500?
500.
So now we're actually going to turn to the ParentTown app, and we're going to ask questions that are coming in from our users. Moms and dads, if you're tuning in right now, feel free to ask any question, and we're going to ask it to Dr. Tiffany Tan right now. So doctor, we have, is it advisable to floss our toddlers' teeth daily? And from what age should we start flossing them? I guess you've sort of answered that, but should it be done daily?
If you can, do it daily. It's very good, because once there's at least 2 teeth in the mouth, there's a gap in between them, the teeth are touching, and as I said, brushing doesn't remove all the bacteria. So if you can floss in between them daily, that will be very, very good.
Okay. And how do you teach kids a routine to make sure they're brushing every part of their mouth in the most effective manner? Any videos and tips on how to do this?
They've got lots of videos on YouTube. Actually, YouTube is something I recommend all my patients. They've got a lot of good videos there. It's very good to show the kids in your own mouth. So I always believe the kids like to model on the parents. So if mom can maybe brush and show them they're brushing the back and make it very exciting. They're brushing the back, you tell them you're brushing the back, and you go to the front, and then after that you go around to the other side, you go to the inside, you talk them through the whole process, then they understand better.
So basically, ham up your acting skills.
Yes, exactly.
Okay. Do I need to use toothpaste when caring for my baby's first teeth?
Well, for the first tooth, that means usually that should be when the baby is about 6 months old, just right about there. I would avoid toothpaste, because at that age they don't know how to rinse, so they can swallow that fluoride. So it's not very good for them to swallow that fluoride. Wiping the tooth with a soft damp cloth is enough. So you wrap the soft damp cloth around your finger, and you go into the mouth and you just wipe around the tooth and the gums as well. That will be enough.
So they sell a lot of these silicone finger tubes as well. Can I use that?
You can use that instead as well. Some parents find that it doesn't cover all the surfaces. You can't manipulate it that well. Okay. So the simplest solution is, as I said, gauze or cloth.
Okay. And when should babies start seeing the dentist? You're saying 1. If a mom doesn't want to start sending her baby to the dentist, is it okay for her to wait till the child is going to school?
School as in
primary school.
Primary school. Primary school, it means 6-7 years old. It's a
Mhm.
bit late. If the mom is on top of the hygiene, you're keeping clean, you're brushing, and you're making sure it's clean every day. And of course, you're checking the teeth, make sure there are no discolorations or any, I would say the latest maybe at about 2.5, 3 years old.
And
That would be good.
is it still recommended to visit your dentist every 6 months?
Yes,
For
definitely.
children as well?
For children as well. Because in children's teeth, they are thinner than adult teeth. So if there's decay, it can start and it can progress very quickly. So 6 months is good.
Okay. I know some food must be avoided when it comes to protecting my kids' teeth. Are there any food best to maintain cleanliness?
Okay, so I think snacks for kids, I think that's what the question is about. What snacks are better for the kids? I would say anything with milk or milk products would be better than fruit juices, which is a very common snack. So I always discourage fruit juices because they are marketed as being very healthy, but they actually contain a lot of sugar. So sugar is very bad for the teeth.
Even
obviously.
natural sugar?
Even natural sugars. So cut fruits are fine because the kid is chewing and it's producing saliva, that's counteracting the sugar. But in juices, it's a liquid, it sticks on the teeth and it actually is very bad for the teeth. So you can substitute that with milk or yogurt, that's very, very good for the teeth.
What about chewing gum?
Chewing gum is good if it's sugar-free. So xylitol chewing gum is very, very good.
Great. We have my son over the past few months had a few falls and chipped his front tooth. It also bled. He's about 20 months old. Should we have brought him to the dentist or just leave it?
Well, this is a very difficult question because we don't know how bad the damage is, and the bleeding could have been from the tooth or the gums or from the lip even if you hit the lip. So I think to be safe, it's always better to bring your kid into the dentist, make sure it's okay. But if you find that it's not wobbly and it's not painful after a few days, you're probably safe.
Okay.
So, I mean, it's already in the past, so I wouldn't worry about that.
At what age can children start wearing braces, and how will I know if my son needs to?
Yeah. Okay. Usually for kids, it starts becoming indicative. I wouldn't say definitely that they will need braces. More indicative if their baby teeth are crowded, or that means that there isn't enough space for the baby teeth. Braces can start at around age 8 or 9 years old, especially in cases where it's very severe. So you can see the jaw sticking out, the front teeth are sticking out, or that sort of thing. So braces can actually, in early age, before the growth starts, it can actually alter the bone, the skeleton. So you can promote the jaw expansion, instead of just shifting the teeth. So we can't do that in adults. So it's good to if you're worried about the teeth, to get a consultation.
Okay.
About 8 or 9. Yeah.
And what about yellow teeth?
Yellow teeth.
What causes that? And can kids go for bleaching, for example?
Okay, I would never recommend bleaching for kids. Most times when the parents are talking about yellow teeth, they are comparing the adult teeth, which are erupting in the front, to the baby teeth on the side. So the baby teeth always appear very white, very beautiful white. But the adult teeth are always naturally a little bit yellow. So when they compare them side by side, the contrast is very obvious. So they are very worried it's yellow. But when the full set of permanent teeth come out, it's all yellow, it's natural, it's the same as the parents. So I wouldn't worry about that.
Okay. We've got most natural, effective, non-painful method to whiten teeth.
Natural method. For kids.
I guess so. Or I'm sure this mom is asking for herself.
Whitening occurs by oxidation of the, I'm being a bit technical here,
Okay.
but it has to be a chemical reaction with the pigments that are in the teeth. So natural, I'm assuming, no chemicals, natural.
So make sure that you don't have too much chemistry with your husband.
That's a good one.
Okay, we've got the last two questions here. We have, my parents don't exactly have the Colgate smile, and neither do I. Is there anything I can do for my child at a young age to help them achieve a straighter, clean, and whiter smile? Or is it hereditary and there's nothing I can do about it?
Okay, this is a very vague question again. Genetics definitely play a part, but there are reasons why maybe your teeth were crooked. Maybe when you were younger, the teeth were taken out earlier. So some parents believe baby teeth, they're not important, they can be decayed, you can just take them out when they're too badly decayed. But that can actually cause some issues with you actually lose space for the adult teeth. So when the adult teeth come out, there isn't enough space and they come out crooked. So maybe try to maintain the health of your kids' teeth. Make sure they don't decay, make sure they're all in place, and that will encourage it to be as straight as it can be.
Okay. I heard flossing is a scam and doesn't do anything for dental hygiene. Is this true?
Well, flossing is something that dentists always nag about, and we don't earn any money from that. So we wouldn't nag about it if it wasn't, true. So if you don't want to floss, that's fine. But it's always better to floss.
Okay, we've got the last question that just come in. We have, the Chinese believe that having pacifiers all the time with young infants would cause Bugs Bunny teeth. Is there any truth to this?
Actually, it's a very good tale, because there is truth in that. Using a pacifier or thumb sucking can actually push the teeth out as they are growing. So in baby teeth, you might feel that your baby's teeth are sticking out a little bit. In baby teeth, they are usually fine. We don't fix that. In adult teeth, as the adult teeth start to come out, we will let you know if your kid is still doing that. Ideally, they should have stopped that by about 3 or 4 years old. But if they're still doing that when the adult teeth come out, which is about 6 years old, that's a bit too late. You should be stopping them from doing that, because it can affect the adult teeth, the permanent teeth, and that can cause the jaw to become narrow and very permanent effects. So definitely discourage your kid from using the pacifier or using thumb sucking if you are above 5 years old.
Okay.
Let's say, yeah.
Thank you, parents, for joining us today for a talk on your kids' oral hygiene. And thank you so much, Dr. Tiffany Tan, for joining us and talking to our parents. Do you have any final words of advice for them?
Thank you for inviting me. I'd like to actually just say a few words about how maybe parents can prepare for the kids' first dental visit. The first dental visit is a very important one, because it's how the kids will perceive the dentist for the rest of their lives. So the first visit is always very stressful for both the kids and for the parents as well, and for the dentist as well. So we want this to be a very smooth experience. We want it to be a very good experience for everyone. It's important to prepare the kid by preparing them for what is going to happen, because kids are afraid of what they don't know. So make it familiar to them. YouTube is a very good resource. You can find a lot of videos on how to approach the first dental visit. I find also role-playing with the kids a very useful tool. The mom and the kid can actually take turns to play dentist with each other. They can check the teeth of the kids and count the teeth together, and then the kid can check mom's teeth and so on. So when they go to the dentist, they know what to expect, and it can be a very smooth visit. So the dentist is always someone very important, because, as I said, it's the first visit. The kid will always remember that that is how they will perceive dentists for the rest of their lives. So I think to find a dentist that is patient and who can walk your kid through the process instead of rushing or not having enough time for the child, I think that's very important as well. So I think that would be good. And I think if you have any questions, definitely just ask on ParentTown. I will be here to help.
Thank you, Dr. Tan.
Thank
And
you.
thank you for joining us again. Good night.